Hello everyone, I'm Stefania, the doctor in pajamas. Why does successful board-certified pediatrician leave clinical medicine to become a certified physician executive and a medical director? I had worked for about 10 years as a general pediatrician, then as a pediatric hospitalist in a small community hospital. Over the years, the administrative burden and the time constraints to see patients the way I intended burned me out. I was helpless, frustrated, and exhausted. At the end of a long 24-hour shift in the hospital, I was called to the ED to see a 2-week-old baby with respiratory problems. The baby had RSV. And for the non pediatricians in the audience, that's an age where this virus can cause apnea or, stop breathing. I discussed with the ED attending, and we both decided that the best course of action was to transfer the baby to a tertiary hospital. The parents were on board. We started the ambulance request. Turns out that the hospital administrator on call heard about it and said that we could not transfer the baby because we had a pediatric floor and the hospital was able to manage that case in-house. I'll give you a few seconds to think about how I felt in that moment. To recap, this was a very small community hospital with no pediatric trained nurses or respiratory therapists and no pediatric ICU. I called the administrator and I had a very heated discussion about it to no avail. Same with the ED doctor. Well, we still called the ambulance transport anyway. Said administrator told the ambulance that they were not leaving with the patient as it was not authorized. Only after the baby's parents threatened litigation, they were able to be on their way. The ED physician quit on the spot in the end of his shift, and I put my notice that day, along with a very long letter to the administrator. That was the day when clinical medicine no longer made sense to me. Despite my love for my patients and the art of medicine in general, I then started searching for a non-clinical opportunity so I could make a difference in a larger scale. And I thought that perhaps if I was on the inside of the administrative and insurance world, I could modify things from the inside out. I now have been working as a medical director in both the managed care and commercial insurance space for the past 5 years now, and it was truly the best decision of my career. I have developed process improvement projects, strategies, I have avoided fraud, waste, and abuse, and I have saved millions of dollars in taxpayer funded payments. As a next step, I believe I can teach other physicians that they too can transition out of clinical medicine into other areas and feel fulfilled and accomplished. In the next 15 minutes, I will show you 3 things. What is managed care and the role of a medical director in health insurance, how you can get involved and apply for those positions, and how you can do a deep dive with me to be more successful in your application process and, of course, your first few months into that new career. So, what is managed care? You probably already know, but let's recap quickly. Let's say your dad asks you to take care of your cat for a month. He pays you $50 to do it, but he expects you not only to feed the cat, but also to bathe, trim the nails, train it as a circus animal. Basically, most states' Medicaid pays a fixed amount per member, and the managed care company has to control costs and to improve the health outcomes and meet all of the quality measures with the same amount of money. So there are also caps into how much profits those companies can make. The role of a medical director in those companies is primarily utilization management, which means reviewing the claims for medical necessity, be it a prior authorization or an inpatient request, and apply the applicable company policies or medical necessity criteria. There's also a case management component where you can discuss complex cases with the company nurses to come up with ideas for placement, home care, to assist those members who do not have any support. Medical directors also can do appeals and state fair hearings, which are a third level appeal outside of the company. Some companies also do community outreach, for example, health fairs, educational talks, distribute food, give baby items, cellular phones so the patients can get in touch with their doctors. I was pleasantly surprised when I joined this line of work, as I previously had a negative view of insurance companies. There's a lot of compassion and caring professionals doing the work. So many amazing stories of patients that are no longer homeless or hungry once they switch from straight Medicaid into managed care. Now, commercial insurers are also starting to model some of those initiatives, as they realize that social determinants of health are real and can improve significantly their patients' outcomes when addressed. As a commercial medical director, you mostly do utilization management or case reviews, but you also can get plugged in fraud, waste, and abuse initiatives, or also on the appeals level, usually doing same specialty reviews. Some doctors are on the claim side, also reviewing cases after the service has been provided. If you are curious about this and the day-to-day work of a medical director, I have developed a course that does a deep dive into this line of work, and also pharmaceutical company jobs, and of course also gives idea for different and multiple streams of income. I can teach you how you can perform a great medical review, peer-to-peer calls, and how to have the right mindset and attitudes in this industry. About a year ago, I started mentoring and teaching a family doc friend of mine about the industry, and gave her all the info she needed to succeed at her interview. Not only that, but I placed an internal referral to her and she got the job. That's the sort of thing I teach in my course. I would suggest as a proactive step would be to obtain as many state licenses as you can, especially in states like Florida, Texas, North Carolina, and Kentucky, which have many regulations for utilization management. You will become a high commodity if you have those. Also, as the years go by, if you're out of clinical practice for longer than 2 years, many states restrict your ability to obtain their license, so you might be limited. So how can you get in? The most effective way to get an interview in one of those companies is through a direct referral. If you do not know anyone, do your research on LinkedIn and Indeed for utilization management and medical director positions, and also try to connect with a recruiter. Make sure you get involved in your hospital's medical executive committees, do peer-to-peer reviews, do quality improvement projects so you can add that into your resume. I love the CME eligible courses offered by the AAPL, and of course their certification process to become a CPE. So that's also something else you can start working on. When I was just starting, I had my first interview with a medium-sized company, and I got a phone interview with their VP of medical management. During the interview, she started asking relevant questions about, and in my course, I will teach you how to learn the basics of this industry so you can do a powerful interview as well and ask appropriate questions in return. And also how to start your new position feeling confident, making the transition very smoothly. Great news is that these days most positions are remote, which means you get to work from home. If you enjoy research and clinical trials, then I would surely look into big pharma. Not only they're the major players, but also there are tons of startup biotech companies that hire medical directors to oversee their new drug trials, their development. And if you're interested in learning more, register your email on my website, www.doctorinpajamas.com, and I'll send you my ebook for free. For the past 5 years, I have had more flexibility on my work schedule, no overnight calls, no weekends. I have had improved family time and actually made more money. Best of all, I was able to help my friend leave a very stressful job as a family practitioner and become a medical director in a major insurance company. after only a few months of mentoring and by placing a direct referral to her. And to this day, she calls me to ask questions and brainstorm. She has embraced this new life, is now attending all her children's soccer games and recitals, and taking more vacation than ever, and truly enjoying working in her new pajamas. I'll leave you with one last question. How would working in your pajamas feel to you? Bye.